To get a deeper understanding of governments, policies, and societal issues, we are here to present about how laws are important for maintaining such regulation of behavior in an individual. Before getting into the subject, the famous philosopher named Thomas Hobbes, in his book Leviathan, discussed that in the state of nature, man always revolt against the weaker personality. Everywhere, man is at conflict with one another. He tries to motivate to escape this chaotic nature of state by creating a social contract. Thus, through the social contract, he was able to prevent the loss of life and emphasize a strong government and social order, which resulted due to the lack of security and protection. So, a topic of discussion of why laws are significant is mainly to resolve the conflicts, to create a framework of interaction between the society and the governmental institutions, and further to eliminate or prevent the chaos, and finally to create a fair and just environment. Hello all, good evening. Today's topic of discussion is related to public health and the safety. Yes, we are talking about the drug usage, which acts as a major public health issue in India. Changes have been brought in this approach towards drug use over the last few decades. Yet, no systematic attempt has been made to discuss the major drug laws or policies of government of India. Substance use disorder, a significant global health issue. As per the World Drugs Report 2022, roughly 209 million people were recorded to be using cannabis and around 91 million people using opium. Even in India, the rates of cannabis and opioids were high. Despite this, availability of treatment is low. Therefore, the treatment gap for substance use disorder is around 90%. The government of India has taken steps relentlessly since independence to tackle the issues of drugs use in India. Many drug acts has been enacted and amended during the past 7 decades. Relentless steps has been taken by the government to decrease the harm, to combat the addiction towards drug use, and to prevent the negative consequences that were related to the drug abuse, and most importantly, to minimize the crimes related due to drug addiction. Example, human trafficking has been more prone in the frontier borders. And lastly, to shape the public perception and to bring an attitude towards information related to drug use. To address the drug misuse, the government of India has taken multi-pronged approach to address the issues. Firstly, it was supply reduction. Under supply reduction, it aims to reduce the availability of illicit drugs to various laws and policies. In this manner, the Narcotics, Drugs and Psychotropic Substance Act has been implemented by the Government of India. Additionally, various central and state government ministries and agencies were primarily enforced to look after this supply reduction approach. Second approach is demand reduction. The sector works for the prevention and early identification, treatment, and rehabilitation of those with drugs. Thus, to reduce the demand, it has been subjected under two nodal ministries. One is Ministry of Social Justice and Empowerment, and in addition, it assigned the role to provide treatment and rehabilitation services to persons using drugs to Ministry of Health and Family Welfare. And third, and the most recent edition of approach the government of India uses is harm reduction. Under this sector, it primarily aims at HIV prevention in India. Harm reduction strategies were implemented by National AIDS Control Organization under Ministry of Health and Family Welfare. So, how does the drugs prominence has been seen in around the history in India? The cultivation of opium in India dates back to 10th century. Around 1920s, with the pressurization of nationalists provided the provincial governments to bring laws to control the consumption of opium. Thus, the Dangerous Drugs Act was passed in 1930s. This was primarily to control the drug cultivation, manufacture, sale, possession, etc. The drugs were derived from the plant substances such as poppy, hemp, coca, and the control was primarily through licensing and penalizing unlicensed activities. Around 1940s, Drugs and Cosmetic Act was enacted to regulate the medicines including those developed from cannabis and opium. To maintain the spirit of United Nations conventions, certain objectives were framed by the India to have a national action plan on drug demand reduction. First one is preventive education, awareness generation, identification, counseling of persons dependent on drugs. In addition, it also provides training and capacity building to the central and state governments to see a collaborative efforts, and nextly reduce the stigma and discrimination against the persons using drugs. This action plan was objectified to address this issue and to facilitate research and provide community-based services and implementation of drug demand reduction through multi-agencies and reduce the harms related to drugs use. So, the government of India has brought certain laws and policies to curb the illicit use of drug usage. Article 47 of the Indian Constitution says the state shall endeavour to bring about the prohibition of consumption, except for medicinal purposes, of intoxicating drinks and drugs which are injurious to health. India plays a part is a party of three conventions. The first is related to the narcotic drugs of 1961, and the second convention is about the psychotropic substances of 1971, and the third is the convention against illicit traffic drugs in 1988. To give effect to these obligations, India passed and implemented Narcotics, Drugs and Psychotropic Substance Acts in 1985. This act covers three broad categories of drugs and substances. One is narcotic drugs, second is psychotropic drugs, and the third is controlled substances. Till date, the NDPS Act has been amended 3 times. Each amendment led to more stringent and harsh provisions. But the 2014 amendment was made, which included the creation of new category named essential narcotic drugs to regulate certain essential narcotics in a unified manner across the country. Also, to widen the objective of law to promote medicinal and scientific use, to balance and control the availability of drugs. Further, introduction of the terms management and recognition. So, several aspects of the act needs attention. What is the how here comes the question. How can a mental health care act be used for a substance use disorder? Yes. Let me explain this. The Mental Health Care Act of 2017 includes the substance use disorders in the definition of mental illness. It protects the persons with addiction from cruel, inhuman treatment at mental health establishments. Furthermore, the inclusion underscores that SUDs are health problems rather than law and order issues. And in 2016, the Rights of Persons with Disabilities Act replaced the Persons with Disabilities Act of 1995. The Act upholds the dignity of every person with disability with a rights-based approach. But a gazette notified that SUDs were included in the mental illness category. So, in the gazette, it points a person with SUDs is eligible for a disability certification. Section 71 of NDPS Act states that the government may establish, recognize, or approve as many centers as it thinks fit for identification, treatment, management, education, aftercare, rehabilitation, etc. by the concerned government of any narcotics, drugs, and substances to the addicts registered with the government. Ministry of Social Justice and Empowerment provides the financial support to establish district de-addiction centers in various vulnerable districts. The Nasha Mukt Bharat Abhiyan, under the aegis of Ministry of Social Justice and Empowerment campaign, has an active outreach program with the access of discussion forums, information, communication material. The addiction has been curbed at the grassroots levels, and also health insurance schemes have been subjected to evaluate recently under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. The government most recently released the Telemedicine Practice Guidelines 2020 during COVID-19 first wave. This not only eased access to mental health care, but being an over-inclusive patient-centric service, it eased access to substance use disorder treatment. However, a few loopholes are there in this guideline. They include inclusion of medication used for SUDs in the list A are notified in telepsychiatry guidelines. The list A includes relatively safe medicines with low abuse potential. Similarly, drugs such as benzodiazepines and opioids are included in Schedule X that fall under NDPS Act and hence cannot be prescribed through teleconsultation. There are few limitations to this novel program. However, it needs to be emphasized that since in India only mental health has a separate telemedicine guideline, this might decrease the treatment gap of SUDs in India. The policy should be interlinked with varying implementation and coverage across the India. Comparison of India's drug use policies with that of other countries will give a bird's eye view of the strengths and weaknesses of current Indian approaches and provide necessary inputs for an amendment if any. Thank you. Have a great day.